Hello, my name is Rosemary Bayang, and I will be performing an intermittent urinary catheterization for patient Mary Smith. Miss Mary Smith has an order from the provider for an intermittent catheterization, and the order reads, if client has not voided within 4 hours, use bladder scanner to check residual amount, and if amount is greater than 200 mL, then perform intermittent urinary catheterization. Bladder scan was used, and there is 400 mLs of urine in Miss Mary Smith's bladder. So I'm going to go ahead per provider's orders to perform a urinary catheterization per sterile technique. So I have my supplies with me. I do have a towel and a washcloth, which I'll be using, and I have a hand sanitizer, a soap, and then I do have the catheter tray with an expiration date of August 31st, 2024, and I also have some clean gloves. And I have before me Miss Mary Smith, so I'm going to go ahead and provide privacy. Make sure the door is locked, the curtains are drawn, and then I will perform hand hygiene. I'm going to go ahead and use a hand sanitizer for my hands. And I will ask patient to identify herself. Miss Mary Smith, can you please provide me your name and date of birth? And Miss Mary Smith confirms her name and date of birth. Mary Smith date of birth is 4/27 of 1976. And Miss Mary Smith, I'm going to go ahead and perform an intermittent catheterization for you. I'm going to insert a catheter into your bladder so we can drain out the urine that's in your bladder. Okay, so I'm going to go ahead and put on clean gloves. And with clean gloves on, I'm going to go ahead and position Miss Mary Smith in a dorsal recumbent position with her knees falling out. So I have my mannequin with me that I'm going to use for this procedure. I'm going to move the camera a little bit to visualize what I will be doing. So I'm going to go ahead and wash Miss Mary's peri area with soap, and I'll give her a clean wash, and then I'm going to use a cloth to wipe to clean the peri area, and I'm cleaning from the top to bottom on each side, and cleaning from front to back. So once I'm done cleaning, I'm going to go ahead and take off my clean gloves, discard of the gloves appropriately, and then I'm going to go ahead and perform hand hygiene. So now I'm going to use a sterile technique to open the catheter, insertion catheter tray. So I will take the wrapping off and remove the contents from the wrapping. And I'm going to open them by pulling the flaps on the opposite direction. Try not to touch the center of the tray. And then I'm going to go ahead and remove the sterile drape from the kit and place under Miss Mary's buttocks. And I'm doing that while maintaining my sterile field at the same time. And now with that done, I'm going to use a sterile technique to put on my sterile gloves. So I'm going to hold the gloves, making sure I do not touch the inside of the gloves. I pull the gloves on. And I'll do the same thing, pinching the glove from the outside and pulling it up without touching the inside of the glove. And now I do have my sterile gloves on. I'm going to go ahead and prepare the tray. I will open the package of betadine swabs. And then I will also apply some lubricant on the catheter. And then since I'm right-handed, my right hand is my dominant hand. So I'm going to stay on Miss Mary's right side since I'm right-handed. And then I am going to go ahead and spread the labia. With my non-dominant hand, which is my left hand, and I will keep my hand, would not move my hand from the patient while I clean. So I'm going to go ahead and use the first swab to clean from the top. Move my camera a little bit towards this side. From the top to the bottom. On one side, discard of it. And I'll use the second swab to clean the right side from the top to the bottom. Discard of it. And then I'll use a third swab to clean the middle from the top to the bottom, and I'll discard of all. So now I'm going to go ahead and insert the catheter, and while placing the open end of the catheter in a receptacle, I'm going to go ahead and put the catheter in place. I will insert the catheter and keep inserting till I get urine return. And I will hold the catheter in place until the urine is fully drained. With urine fully drained, I am going to go ahead and pull out the catheter and discard all the supplies. And then I'll go ahead and take my hand off of Miss Mary. Go ahead and perform pericare. Use some wipes to clean Miss Mary the same way. Clean both sides of the labia and clean in the middle. And then I'm going to go ahead and provide privacy and remove my gloves. Then I'll perform hand hygiene. And then I'm going to go ahead and document the procedure. So far, I got 350 ml of urine from Miss Mary's bladder, and I'm going to go ahead and document that and report to the provider. Thank you.